Eritrea's national health system has been remarkably successful at eradicating communicable diseases, including HIV. It was the first African nation to meet all the UN's Millennium Development Goals regarding health. Much of its success at eradicating communicable disease has been due to vaccination, especially childhood vaccination. But it has thus far chosen not to institute mass vaccination for COVID-19. COVID Racing Democracies and Garrison has more from On the Ground in Asmara, Eritrea.
Eritrea has been criticized for not yet instituting mass vaccination against COVID-19, but thanks to preventive measures, it has sustained a remarkably low rate of COVID infection and death, 9,734 cases and 103 deaths in a population of 3.6 million. PCR tests are required for entry, and masks are widely worn in urban areas. I spoke to Eritrean Minister of Information, Yamani Gebremeskel. You're part of the National COVID Task Force, and the task force has chosen not to institute a mass COVID vaccination program, but you've nevertheless sustained a very low rate of COVID infection and death. Could you explain the decision not to institute the mass vaccination program?
We're not talking about a categorical or unequivocal decision not to introduce vaccination. But I think when the pandemic broke out, I think patient zero here was somebody who came from abroad in March 2020. And the first thing that was done was to look at it's called a two-track approach. One, preventive measures,
right.
Mandatory masks, physical distancing, disinfectants for equipment, and so on and so forth. And in fact, originally, I think it was decided for 3 months, but we had a partial lockdown that was extended for almost 6 months. It was partial lockdown because all the agricultural activities were not affected because mostly they are in the open and they are smaller units, so you don't have huge crowds. So the transmission rate should not be huge. That was the assumption. The industrial sector was not also affected, but all public institutions were closed. All the public services, hotels, restaurants, all that was closed. So that was that went on for only 6 months. The government also pursued a very aggressive policy because we have a very porous border, and we had people coming back from Ethiopia, from the Sudan. At one point in time, flights were also banned. But when people came through aircraft, we had, of course, the testing and so on and so forth at the entry point. But for people who came through land routes, there were extensive quarantine centers. So I think the preventive measures worked well. I remember at one point it was random testing in Asmara for about 5,000 residents from all the areas. Heavily populated, densely populated areas, and so on and so forth. So to give you a full picture, and there was only one person, and of course his wife, two people who tested positive. So the positivity rate became low. The case fatality rate, at least the figures we have, also they were low.
103.
Now, even when people are vaccinated, even when they have had boosters, they are getting affected. So one big issue is if the natural immunity gives you the same
or better.
Even if it is the same, people say with natural immunity you can affect others, but you will not be affected for 5-6 months. So it's not a closed case, but I think at the moment there is not also an urgency to push the ministry.
To push mass vaccination. You don't.
Yes, I mean, you have to look. I think you have to look. You have to watch the situation closely.
Yeah.
If, when necessary, you can do it. So it's not philosophical or ideological. It's really the reality. You have to monitor the situation and you calibrate your response.
In Asmara, Eritrea, for Pacifica, I'm Ann Garrison.